And I'm going to talk to you on the topic of communicating with intellectually disabled individuals. So we'll go through some strategies to assist you in effective communication with intellectually disabled individuals. So tips that may help when talking with someone who has an intellectual disability include: make sure that you have the person's attention. Use their name to gain their attention if you don't have it, or gain their attention by trying to gain eye contact with them or respectfully touching them on the arm. Start by assuming a person can understand you. This is really important. Don't be condescending. And then adjust your level of communication according to their response. So ask the person how they would like to communicate if they do not use speech. This could include using communication aids or devices, answering with a way of saying yes or no to questions. So they might have their own way of answering yes or no, either by using eye contact or head or hand movements. They might use sign language, gestures, or facial expressions. So if they don't use speech, ask them how they would like to communicate or show you how they would like to communicate. If you're not able to understand the person, you may need to ask whoever is accompanying them to assist you with that communication or assist you with knowing how to best communicate with that individual. Use appropriate language for the person and the situation. As a general rule, use simple, clear words and short, uncomplicated sentences. If the person is an adult, do not speak as though they are a child. Once again, this is very condescending. Use visual information such as pictures, diagrams, signs, objects, gestures, or miming to improve understanding with that individual. Use a respectful tone and volume. If the person does not understand you, try a different way of providing the information or asking the question. So reframe the question in a different way that might assist their understanding. Don't assume that raising the volume of your voice will help. So instead of just repeating what you've said in a louder volume, either repeat what you've said more slowly or put it into different words, into simpler language that the individual might understand. Don't rush. Allow the person the time to listen, process your words, and respond. Waiting patiently conveys interest in and respect for what they will say. So don't assume the person's going to respond to you straight away. They may need time to process what you've said, and they may still understand what you've said. They just need time to then put it into their own words or to respond to you in some fashion. So don't jump in straight away and repeat what you've said. Give it a little bit of time first. So check if they have been able to understand what you have said by asking them to rephrase in their own words. Don't simply ask, "Do you understand?" Because people will often say yes to avoid embarrassment, or if it's the answer they think you want to hear. If you think that you have not been understood, try repeating your message more slowly or using different words, as I said previously. It's your responsibility to make sure your message is understood accurately. If you don't understand the other person, so this also works in the other way as well, don't pretend you understand. Be honest and take responsibility for any communication breakdowns. For example, "I'm sorry," say, "I'm sorry, I don't understand what you're telling me. Would you please tell me again?" If you can't understand or be understood, try another approach. So try different approaches until you get to, I guess, an approach that works for the communication between the two of you. Is there any other way you can communicate what you want to say? And if you're really stuck, ask if it's okay to involve someone who is familiar to that person. So someone who knows the way they communicate and can understand them. So a family member or a support worker. So the overall take-home messages here are to conduct communication without bias, Have respect for all people who have communication barriers and be really patient with them and try to work out what approach works for them. Do not label them. Do not rush complex communication. Try and break communication down into simple, clear language for the individual.